Russia is dominating Beltway politics, that we know. But healthcare has been dominating battleground politics outside of Washington. Together, these two issues may be holding up everything right now for the White House and for Republicans in Congress. And there's very little relief in sight on either issue. And the issue of health care moments ago, the nonpartisan Congressional Budget Office, the umpire of sorts for legislation here in Washington, published its updated analysis of the House health care bill that Republicans passed earlier this month. According to their estimates, 23 million would lose coverage over a span of 10 years. That's not much different from prior estimates. It was about 24 million in the previous bill that ended up not being voted on. This bill that did pass the House would cut the deficit, according to the CBO, by $119 billion. That means the House does not have to re-vote on this legislation due to reconciliation rules, by the way. And the CBO says that some folks with pre-existing conditions in many states could find themselves priced out of the market. The rapid response from the RNC blasted the CBO's credibility on health care. They slammed the agency as way off with its Obamacare predictions, essentially trying to say, hey, don't take their numbers to the bank. And just hours before that CBO score became public, interestingly enough, Senate Majority Leader Mitch McConnell had a strikingly dour assessment of the Senate's ability to get health care done. He told Reuters, quote, "I don't know how we get to 50 at the moment, but that's the goal." It's basically the law if you're going to do anything. Folks, McConnell's not a guy who plays games with this stuff. If he says he doesn't know how he's going to pass health care in the Senate, it's because he doesn't know how he's going to pass health care in the Senate. He doesn't have some sort of trick under his sleeve. He's not about raising or lowering expectations bar. He's not very good at that. So bottom line is they're not in a good place right now at the Senate GOP. So it comes as healthcare anxieties are dominating battleground politics. The airwaves are being flooded with healthcare ads from the big skies of Montana, which holds a special election tomorrow, to the suburbs of Atlanta, which holds that special House election next month. Here's a sampling.
Greg Gianforti says he's thankful for the new healthcare bill, the one that eliminates protections for pre-existing conditions.
We know Quist didn't pay his own taxes, yet he wants to raise our taxes to pay for a government takeover of healthcare.
As a doctor and a breast cancer survivor myself, what Karen Handel did is unforgivable.
I'm currently fighting cancer. When I see ads attacking Karen Handel, they make me sick.
I don't know about you, I just had flashbacks to 2014, 2010, 1994. Anyway, you get the point. Healthcare ads are back in a big way. And we're going to dive into the latest on the Russia investigation a little bit later in this hour, but we begin tonight with that breaking news on the Congressional Budget Office scoring, which of course a Washington term, the House health care bill. Joining me now is someone who I like to talk to for all things budget and understanding the wonkiness of Washington, is Stan Collender. Stan? Help us speak budget ease for this. Okay, so what have we learned from this? We know the basics here. The previous score was 24 million would lose insurance, down to 23 million. The deficit number essentially went down. Up or down, however you want to, meaning the deficit is going to be lowered by a less number now with this new bill by $31 billion.
So the deficit will be higher.
Right, the deficit goes higher. So essentially what the CBO is saying is this MacArthur amendment on the essential health benefits got the Republicans a million more people covered. They went down from 24 million uncovered to 23 million uncovered for a price of $31 billion. Worth it?
Probably not. And don't forget.
And am I reading this correctly?
No, you are reading it correctly, but it's not just that the coverage would be, fewer people would be covered, it's that some of the coverage would be less valuable. So it's not a complete apples to apples type of thing. It's 31 million people less, and others would have less coverage even though they'd be paying more.
Now the Republicans are going to say, hey, the premium numbers are going to go down, and CBO says that. Premium numbers absolutely will go down. But then they also say if you have a pre-existing condition, you are likely to get priced out of the market.
Well, look, as someone who's a cancer survivor, this is the kind of thing that concerns me greatly. And it should concern everybody, because almost everybody's got a pre-existing condition in one way or another.
If you were born, you were born with a pre-existing condition. Meaning like everybody. Everybody's. Yeah. At some point, a scientist can claim anything's a pre-existing condition via genes.
Yeah. No, absolutely. And it's not just a question of lying around doing nothing and being lazy and eating fried foods. My dad gave me, I inherited his genes, and I've got his diabetes, even though I work out like a fiend and I eat well.
So you have a pre-existing condition?
I had a pre-existing condition. But let's keep in mind here that the Senate has already said they're not taking up the House bill.
Right.
All right, so while I think this is probably going to be very difficult for Republicans to explain, I think they're extremely grateful right now, taking a deep breath, that they don't have to take another vote.
Now, explain why they would have to re-vote. I mean, we're using so many, and I apologize here to viewers that get frustrated when we speak too much Washington. You know, we're saying CBO, we're saying scoring. You know, these are not the way Americans speak about their checkbooks. But why would they have had to re-vote? What would have come back from the CBO that would have said revote?
Okay, in simple terms, without going into budget wonkishness, the House and Senate are considering health care under special rules that would essentially prevent a filibuster from being used. So you need fewer votes under those circumstances. You only need 51 votes in the Senate to get anything done, 50 if Mike Pence is willing to vote for something.
Right.
So the revote would have occurred because the bill that passed the House didn't qualify under those rules. So they were waiting for CBO to say, yes, it's okay, we bless it.
So now the ball truly is in the Senate Republicans.
Right, right. And in fact, they were probably hoping, the Senate Republicans were probably hoping, maybe the House will take a revote, they won't be able to pass it, so we won't have to do anything on this.
Now, there has been a sort of there's a reason why health care went first, as far as Congress was concerned, because, and we've had, they wanted to get savings out of here in order to do tax reform. They wanted to do health care under the 2017 budget and do tax reform under the 2018 budget. Their deficit number in savings here is $131 billion over 10 years. They wanted more than that to apply to tax reform. What does this mean for tax reform?
Well, the very simple answer is, I've been telling clients this since January, this doesn't make it any easier. Tax reform, which is always going to be difficult now, it becomes a little bit more expensive and becomes more difficult for them to find the savings they need unless they decide to hell with the deficit. Right? We'll blow it up, we'll spike it, we don't have to pay for things. That's a possibility under tax reform. Remember, '86 they started with an agreement between House Democrats and Republicans. It's going to be revenue neutral. That is, tax reform would not increase the deficit.
Right.
Here they don't have that agreement. They were hoping this would make their lives easier.
Now, among the criticisms that's going to come on CBO when they score the budget eventually, and because we've already seen the skirmishes, and already there's a back and forth between the White House on their assumptions on economic growth. Their assumption on 3% growth, did they use good math or did they use funny math?
Well, funny math is probably giving it the benefit of the doubt. The Congressional Budget Office and the Federal Reserve, along with a bunch of Wall Street firms, say that 3% growth is extremely unlikely. They're estimating less than 2% growth. So where Mulvaney, the White House came up with 3% growth, it looks like it's more wishful thinking and a little bit of praying rather than solid economics.
What is the best way? Let's say someone's watching out here and going, what is the most neutral economic growth assessment you can find? Where are the most reliable indicators for projections like that?
Well, first of all, in spite of what the White House and the RNC were saying, the Congressional Budget Office has actually done a pretty good job projecting the economy. Now, remember, anything that's 10 years from now is pure speculation by anybody. But CBO has done a relatively good job. Remember, its only purpose in life is to try to get the numbers right. But if you do a combination of the blue chip indicators on Wall Street, the Federal Reserve, and the Congressional Budget Office, you start to regress towards the mean here. And I would take the Federal Reserve over OMB almost in any day of the week, no matter whose administration it is.
So we're looking at economic growth somewhere between lower than 3 but above 2.
It's not clear it's going to be above 2, but keep in mind what this does. Mick Mulvaney, the OMB director yesterday himself said, if we don't get 3% growth, we don't balance the budget. In fact, we have a large deficit.
Is there a realistic balanced budget program that could happen from anybody if you don't touch Social Security or Medicare? Because that seemed to be laughable to me that they were claiming a balanced budget and not touching Social Security or Medicare.
Well, they were touching Social Security disability.
Right.
Right. But they were hoping for rapid growth. I mean, it would be great. It's almost like what David Stockman was doing during the Reagan administration, where he was projecting rosy scenarios. And this is a rosy scenario on steroids.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.